Now we live in a great era in terms of providing ophthalmic care. If you think about over my career, the things that we're doing now were unimaginable. For cataract surgery, it's gone from a 3-day hospitalization to a topical anesthetic, a 10 to 12-minute procedure that you're in and out and back to full activities the next day. And I don't even bandage the eye at the end of cataract surgery. And the level of precision that we're able to do, with the computer and the miniaturization of the instruments that we're able to use, that we're not invasive, but we're truly minimally invasive and able to allow a phenomenal level of vision in very short order. As a normal phenomenon as we age, the cataract, which is called the crystalline lens, does age, and it ages because it's the highest protein content of any part of our body. And the majority of it is albumin, the same as an egg white. And obviously at a much slower pace, over time, it does cloud over and yellow. And so for all of us as we age, we will all develop cataracts at some point. Progression that we've seen in cataract surgery over relatively a short period of time has been very dramatic. Initially, cataract surgery was done where truly the whole lens was removed. And for many of us, remember grandparents who walked around with thick glasses, and that was very difficult for them because the optical correction was not very good. And then you evolve now into implants, and the implants have had an equally explosive career in the sense that initially we used what were called iris clip, then anterior chamber, and now we use, for many years now, exclusively posterior chamber lenses, which goes in the original position of what the human lens was. And then that evolution now, with the choices we have, is even greater still. Another tremendous breakthrough with the premium intraocular lenses is the multifocals. And for the very first time, basically for all of us over 40, we've been accustomed to the fact that you're going to have distance glasses and a bifocal or reading lens. And for the first time with the multifocals, they actually give you both distance and reading. So that's a tremendous breakthrough. So for people who are really looking to be glasses free, we can actually give out of the same eye distance and reading. Where Medicare in the past has been, if they allowed a procedure, there was no avenue to, quote, upgrade that option. And so when the lens manufacturers came out with what we consider now to be premium intraocular lens, specifically the multifocals and the toric, which corrects astigmatism, that the cost of development and so forth could not be borne in the original cost of cataract surgery. So Medicare made a ruling that is held for all the insurance industry that, they still pay for cataract surgery, but they pay for what we call a standard monofocal implant. If you want a premium intraocular lens, you're now allowed to have it, although you do have to pay out of pocket for it. It's a wonderful time in ophthalmology because the level of expertise and care that we can deliver both on the LASIK side and the cataract side is truly unbelievable. It really is something that I tell patients on a daily basis, that not that many years ago, it was unimaginable what we're able to provide on a routine daily basis.